You may have questions or concerns about your furry family members undergoing surgery or anesthesia. The staff of the Shannondale Pet Hospital understand these concerns and have made a short video to help you see exactly what happens when your pet has surgery at our hospital. We will be following Abby as she undergoes surgery to be spayed, and we may also see Cody along the way as he is at the hospital to be neutered. So preparing for surgery actually starts the night before. While our vet assistant Ashley is reminding Abby's owner about her surgery, Stephanie, our pet care attendant, is also preparing for Abby's big day. She is getting the surgery and treatment rooms ready for tomorrow. This involves setting up Abby's kennel and laying out the equipment required for Abby's surgery and anesthesia. Mrs. Jones arrives at the hospital with Abby ready for her big day. After getting some initial information and paperwork completed, Abby is admitted to the hospital and brought into the treatment room. Cody arrives with Mr. Jensen ready for his big day of surgery as well. After Abby is weighed to determine her anesthetic medications, she will have a brief exam noting her heart rate, respiratory rate, and her temperature. This information will be important to the doctor when they do their pre-surgical exam on Abby. Once the doctor has arrived, they will review the information gathered about Abby, as well as give her another brief exam, listening to her heart and her lungs. The doctor will confirm that the anesthetic protocol chosen for Abby is still the ideal protocol, and will review that the doses of the anesthetic medication are accurate. Then the doctor will administer Abby's sedative. Shauna, a registered veterinary technician, will draw some blood from Cody and run it on the in-house lab machines. This blood work will give us a look at how healthy Cody is internally. We will get information on how well his organs, such as his liver and kidneys, are functioning, as well as any underlying infections, anemia, or clotting problems he may have. While we are waiting for Abby's sedative to take effect, Shauna will ensure that the surgery room and anesthetic equipment are ready for Abby's surgery. She will also leak check the anesthetic circuit chosen for Abby and turn on the bear hugger. The bear hugger is a warming device used for pets while under anesthesia because they are unable to maintain their body temperature. It looks like Abby is nicely sedated and ready for her IV catheter. During the catheter procedure, Abby is being pre-oxygenated. Shauna will place the catheter in Abby's vein in order to give the injectable anesthetic, as well as her IV fluids throughout the surgery. This IV access also allows for any emergency medication to be given quickly if required. She is then hooked up to monitoring equipment, which will monitor her heart rate, how well she is breathing and exchanging oxygen into carbon dioxide, her blood pressure, and her oxygen saturation. Once Abby is secured on the surgery table, the final prepping of her surgery site will be completed, and during this time the doctor is also performing an antiseptic scrub on their hands and arms. Then they will put on a sterile gown and gloves and proceed to the surgery room. After Abby's surgery is complete and she is starting to awaken from her anesthesia, she is extubated and brought to her recovery bed in the treatment room, where she will be closely monitored. Then she will be taken to her recovery kennel and monitored closely throughout the day. Then it is time to get ready for Cody's surgery. The doctor will call Mrs. Jones and let her know how the surgery went and set up a discharge time for later on that day. Ashley will also send a text message to Mrs. Jones to let her know throughout the day how Abby is doing. After some time has passed, we can see both Cody and Abby recovering well from their surgery and anesthesia. Abby will be offered a litter box and some food and water, and Cody will be taken outside to go to the bathroom, as well as offered some food and water. Once it is time for Abby to go home, Ashley will go over the discharge information with Mrs. Jones and discuss any care that Abby may need in order to recover from the surgery. Then it's time to reunite Mrs. Jones with Abby. Shauna has also finished going over the discharge information with Mr. Jensen, and Cody is ready to go home as well. We hope that you enjoyed a behind-the-scenes look at the spay or neuter surgery experience that your pets may have at the Shannondale Pet Hospital, and that we were able to answer any questions or concerns you may have had. If you do have any additional questions or concerns, please feel free to ask any of our staff members. From us at the Shannondale Pet Hospital, thanks for watching.